All right, class. So today's lecture is going to focus on how do you conceptualize a case clinically through the theoretical lens of person-centered, humanistic umbrella. Now, for those that like things very like linear and black and white, 1 + 1 = 2, might struggle with conceptualizing because you could understand or make sense of or interpret multiple different situations and scenarios using various constructs. So don't get caught up in finding the perfect construct to define this behavior. Just be flexible. I want you just to play with the theory, try on the theory. Really, the goal is to just deepen your understanding of how to interpret or understand or define or make sense of certain behaviors, problems, conditions through various theoretical lenses. So as long as I can see that you're trying to interpret a case using the actual language and constructs from a theory, you're going to do well in this class. And so using the concepts from Gayhart's textbook and from her lecture videos, and then also other resources or just literature that you can find, feel free to use that too to help you conceptualize the case clinically. As I said, I really want you to, what we're doing is we're learning how to deepen our knowledge and understanding of theories. So if you look at Gayhart's book, in this week's reading, you will see that there are a various amount of definitions and concepts for you to understand. I'm not going to go through all of them in today's lecture because Gayhart does that in her lecture, which is this week's for this week's assignment. I'm just going to show you how to conceptualize this case clinically. All right, so if there is something also that you see in the lectures I'm sorry, if you see in the textbook that's not in the lectures or vice versa, feel free to use what your understanding of the theory is and how to apply it to a case. Okay. So some of the core concepts and themes of person-centered are self-actualization. What that means is, in self-actualization is, I have Gayhart's textbook up right here too. Self-actualization, page, what page is it on? This might take too long to find it. Okay, it's self-actualization is really this innate need and drive that we have as humans in order to be one most authentic and fully realized self. What this means is truly being able to be your true authentic self. So the absence of your true authentic self can cause somebody to have dysfunction or problems, distress, cause impairments in functioning. And so as you're listening to clients in the therapy room, listen for stories that they tell you, because clients will tell us their problems through story form. Listen to the times when the client is not living to their true authentic self. Now, who defines their true authentic self? The client does. The client is the one that defines their true authentic self. When you're reading your case study, read and look for the times the client is not able to live to their true or act out or live in their true authentic self. Now, because we're not treating an actual patient with the case, we're going to make some hypothesis. If it's not black and white or crystal clear, you can say, it seems like the client might be dealing with difficulty with self-actualization, and then put why. This is why I see more further assessment, more further questions would deepen this understanding or knowledge. So feel free to make some assumptions when you're doing your case conceptualization assignment. Another one is Maslow's hierarchy of needs. And as Gayhart discussed in her video, like I said, I'm not going to go through these in detail because she already went through this. But when you're reading the case vignette, are you seeing any of these things play out in the vignette? Do they have their foundational needs being met? Which is psychological needs such as food, water, shelter, sleep. Oh, that should not be there. That, anyways. Um, Safety, security, health. So per Maslow's hierarchy of needs, if somebody doesn't have their basic foundational needs met, they're going to experience more stress, distress, functional impairments, deepening, a worsening of symptoms that cause distress. Also looking at sense of belonging. If a client doesn't have sense of belonging, friendships, family, intimacy, connection, that can cause distress. Self-esteem, how is their confidence, respect for self and others. And so the ultimate goal is self-actualization, is somebody living to their true inner potential, where they have purpose, so they have meaning. And so unmet foundational needs, such as the ones we described up here, may interfere with a person's ability to move towards self-actualization. So if the goal is self-actualization, we want to look at the things that are preventing a client from meeting the goal of being their true authentic self. Another thing to listen for when you're treating a client and you're doing your role plays and you're doing your assignment is this concept of congruence versus incongruence. So congruence is when a person's external presentation matches their internal experience, meaning that they're able to be kind of the same as self-actualization, but it's they're able to have their internal experience and external presentation match. For example, let's say you are sad about something, and a person that is congruent will express sadness outward because they're feeling sad. Incongruence means I'm feeling sad, but I'm going to not act sad. I'm going to pretend that I'm actually happy. Let's say you're feeling stressed about something. Instead of being congruent and saying, I actually feel stressed about this, you act opposite of how you feel. So you act like you're not stressed. You pretend that you're not stressed when you really are stressed. So congruence is being able to truly live and reflect your authentic feelings, needs, or values. Let's look at needs. Let's say you have a need to be validated or cared for emotionally. And so instead of expressing that, you suppress it and shove it down. Values, let's say you're acting out in a way that doesn't align with your values. High school student wants to fit in, doesn't want to be rejected. And so they are willing to go to this party and engage in substances or go to a concert, even though they don't really like the music or like the concert. But they're doing it to get acceptance or to avoid rejection. So here's another example of somebody being incongruent. And so per the person-centered humanistic umbrella, a person might experience distress or worsening of symptoms or pathology if they're acting incongruent. So as you're doing your case vignette assignment, look for ways where the client is experiencing incongruence. So the change process in the textbook outlines the different steps in order to achieve change. So when you're doing the assignment, if it asks for the change process, then you will see here that Gayhart does outline the change process in the textbook, which is on page 141. And so stage 1 is about communication about external expectations, external validations, experiences, perceptions that don't necessarily align with their true self. Stage two is being able to recognize their feelings and then be able to process their feelings, express their feelings, being able to increase your awareness of self, being able to look at where in my life am I not being congruent? Where in my life am I shoulding on myself? We'll go to the shoulding part here. Where are they living kind of like in a facade? So that's the different stage process. Another from Gestalt, from the existential umbrella, is and what prevents somebody from living their true authentic life is what Gestalt calls a boundary disturbance, is when the patterns interfere with somebody's true authentic self. So they put on layers, or are also called neurosis, put on layers that prevent their true authentic self from forming. So one of them is introjection, is you adopt beliefs or expectations from others without taking a step back and taking a really critically objective outlook on a situation. You just adopt it as your truth when it is actually not your truth. It's somebody else's expectations or belief system that's not truly yours. Projection is attributing one's own feelings to somebody else. So we've all heard this word projecting. Oh, you're projecting. So let's say you are really angry, and instead of owning your anger, you assign it to somebody else. You say, gosh, you must be really angry, when actually you're really angry about it. So instead of owning your feelings or your emotions, you project that onto somebody else. Let's say you're feeling fearful about something. Instead of owning your fear, you say, gosh, to somebody else, well, you must be really afraid about that. And the other person's like, I'm not really afraid, but you're afraid. And so the goal is to own your true experience, feelings, and emotions. Retroflexion is turning emotions inward rather than expressing them outward. Let's say you were attacked in college, and you are mad at the person who attacked you. And instead of assigning anger to the person who attacked you, you internalize it. And you say, well, I must have caused this. I must have done something to deserve it. And you internalize it versus expressing them outward. And then confluence is losing one sense of self in order to maintain harmony with others. So when you're sitting in front of a client and you're doing psychotherapy, as a therapist that is adhering to this theoretical model is listening for these types of situations and concepts play out in the client's story. When you do your vignette, this is what I want you to listen for, or actually listen. I want you to look for as you're reading the vignette. Where are these things playing out? Now, guys, you might not see some of these concepts play out in the vignette, and that's fine. You might see them play out a couple different ways. You might say, well, it could be because of incongruence and introflexion and a should statement. That's totally fine. Like I said earlier, it's not black or white. There's not a wrong answer. I just wanted to get you used to and comfortable utilizing some of this verbiage and trying to deepen the understanding. Okay, should statements. I say this to my clients a lot. Are you shoulding on yourself? So these are internal expectations about how a person believes they must think, feel, or behave in order to gain approval and avoid rejection. So let's say I have to be the best at everything. That's a should statement. I shouldn't be upset about this. I should be a perfect student. I shouldn't be upset at my husband. I shouldn't get upset at my kids. So are looking at where our clients not being able to truly express how they think, feel, or behave, where are they putting these should statements on? Okay, so personal constructs and facades. So the kind of the same thing. We're seeing a pattern here. But when an individual presents themselves in a certain way in order to maintain acceptance and safety, which may conceal their true authentic self. They are acting a certain way to gain approval, so they're putting on a facade. And so the goal in person-centered is to have to be congruent, to be self-actualization, to have a sense of agency and self-acceptance. Acceptance of their situation, acceptance of their thoughts, their feelings, who they are, and not trying to be someone that they're not. Okay, so here are some core therapeutic interventions that the therapist implements in the therapy session. Unconditional positive regard. How do you provide consistent acceptance and non-judgment support to help the clients feeling safe and exploring their internal experiences? Unconditional positive regard doesn't mean that you accept what the client is doing. Unconditional positive regard means you accept the person for who they are. And this might be easy for us to do as Christians, because when we look at it, this is the heart of Jesus. Jesus does not reject the person. He may not like the behavior, what we're doing, but at the end of the day, it's true, authentic acceptance and love. So as a therapist, how do you see your client through the lens of Jesus? How do you see it through this lens of, I genuinely accept you for who you are as a person? The problem is we all have biases. We all have things that trigger us. We all come into the therapy room with our lived experience. And because we're human, it's easy for us to become judgmental, critical, judgy. And if you present that way to your client, you're not going to cultivate a safe relationship. It's a matter of when you experience countertransference. And if you haven't heard about countertransference in this program yet, it's when you are starting to develop feelings toward your client that are not neutral, meaning that you're angry with them, you're annoyed with them, you judge them, or the opposite, you really, really like your client, you think they're attractive, you want to be their best friend. When those things happen, if they're not addressed and dealt with through your supervision and your own personal therapy, they can actually cause harm and create your client to be unsafe. Okay, so empathy. Empathy is not sympathy. Empathy is to be able to truly tap into something inside of you that can understand what your client is going through. You don't have to agree. Empathy is, makes sense. I can see how you came to this. How you do this is you look at everything as a symptom. When we think clinically, somebody who's engaging in pornography, we're not looking at the pornography. We're looking at underneath what's driving it. Once you can tap into what's driving the behavior, we can actually have empathy for that. Empathy for somebody who's cheating on their spouse. Cheating on their spouse is a symptom. We want to go deeper. So therapists do not get caught up in what's happening on the top, on the outside, on the surface, on the symptoms. We are focused on what's driving it, what's underneath. And so that's one way to work through countertransference or triggers, is by being able to look at what's driving it, the deep pain or emotion. It's easy for us to have empathy for that. The other part is congruence of a therapist. Especially with teenagers, they can smell out a fake, phony therapist any day. Be yourself. Still be professional. Still want to be professional, but be your true, authentic self. That doesn't mean that you share your opinions. That doesn't mean that you give advice. That doesn't mean that you make the session about you. This is when you're the therapist, this is not the place for you to work through your stuff. So your political beliefs, your religious beliefs, your personal experience does not belong in the therapy session, the congruence is you're just your true, authentic, genuine self. You can be genuine and you don't have to put on a facade. You don't have I should be this. You're just true and authentic. And the congruence of the therapist is what creates safety for the client then to start to learn how to be congruent. Another intervention is the here and the now, is asking clients questions about what they're experiencing in the moment. And that could be something like, what are some feelings that are coming up for you right now as you talk about this? I noticed when you brought up this situation, your body kind of shifted, and tell me more about what's happening. I noticed when you talked, you kind of looked down. What are some emotions that are coming up? What are some thoughts that are coming up? What do you think about that? So it's about here and the now, in the moment, to increase awareness to their emotions, their cognition, their thoughts, and their bodily experiences. A lot of the communication is nonverbal. And so by just helping the client to make sense of what they're feeling and they're thinking is going to help develop self-actualization and congruence, because we're deepening the moment for the client. Another intervention is increasing awareness of the authentic self. And so this is helping the clients recognize their true feelings, desires, and values. Already talked about the body reactions, body sensations, exploring internal experiences. So noticing if there's any conflict. So if a client's like, yeah, I'm really sad about my sister getting a divorce, but they're not allowing themselves to truly experience it. I gotta be the strong one for my family. So if I hear a client say, gosh, I gotta be the strong one for my family, but then what I'm hearing them say is they really do have a feeling about this. Say the example of their sister getting a divorce. Like, well, it's not my marriage. And my family wants me to be the strong one, so I really can't express how I feel. That would be, if I'm listening for that as a therapist, then what I want to do is facilitate the intervention to help the client see how they truly feel is not coming out, and then give them space to process their actual authentic feelings and their emotions that are conflicting with their shoulds or external expectations. Okay, so now we're going to use a mock vignette, Olivia, and then I'm going to show you how to format your assignment. Olivia is a 34-year-old woman who sought counseling after describing a persistent feeling that she is living someone else's life. She works as an accountant at a large firm, a career she pursued because it was strongly encouraged by her parents. Olivia reports from a young age she was described as the responsible one in the family and was often praised for making practical choices and not taking risks. Despite our success, Olivia describes feeling empty and disconnected from herself. She reports waking up each morning with a sense of dread and thinking, I should be grateful. I have a stable job, a good partner, a nice apartment. Why do I feel so unhappy? She often compares her life to what she believes it should look like and feels ashamed that she's dissatisfied. So when a client first comes into session, they're going to present as mainly like their symptoms. Gosh, in the morning, I just wake up with a sense of dread. I feel depressed. I feel hopeless. Then as the therapist assesses and asks more questions, then we'll get more of this information from the client. Usually clients don't come out of the gate with this neatly of a presentation, but for the assignment, I wanted to make it a little easier. Okay. During the intake session, Olivia frequently spoke about what others expect of her. She stated her parents sacrificed a lot for her education. She feels obligated to continue working in the career to make them proud. She explained that she rarely expresses disagreement with others because she worries about disappointing them. When conflicts arise in her relationship, she often suppresses her feelings and later experiences resentment and emotional withdrawal. She describes herself as easygoing, goes with the flow, yet she also reports episodes of irritability and emotional outbursts that surprise both her and those around her. She states that sometimes she suddenly becomes overwhelmed with frustration, but cannot clearly explain why. Afterwards, she tends to apologize quickly and minimizes her feelings, telling herself that she's overreacting. Okay, I'm not going to finish the rest of the vignette, but I want you to take a second and think, based on what we just talked about, are you seeing some of these person-centered humanistic concepts play out with Olivia? So here she has her concerns are persistent feeling of emptiness and dissatisfaction despite external success, difficulty identifying personal desires and preferences, frequent use of statements about what she should do, fear of disappointing others, and strong pressure to meet expectations, emotional suppression followed by occasional unaffected outbursts, struggles to express true authentic feelings, and sense of being connected from her true self. So when I ask you guys to list the presenting problems or concerns, don't just copy and paste the vignette. I want you to show me the presenting concerns when it talks about the presenting problems or presenting concerns. So it's presenting problems or concerns. It's both. I want you to use person-centered humanistic language. Okay, so this is how we write our assignment. You can do it a couple different ways. If you want to just do paragraph form, you can. If you want to do bullets, you can. So you're basically going to plug in the vignette to the theory. So here we go. Olivia expressed a desire to understand herself better and states she hopes therapy will help her figure out who I actually am and what I want. This is where I want you to cite your sources. Do not just put Olivia is experiencing a lack of self-actualization. I want you to actually give detail of how you're seeing that play out in the role play. So from a humanistic perspective, a disconnection between authentic self and external expectations from others can cause distress in clients. Cite your source. And do not say Dr. Plant's lecture. I want you to show me from the literature, from what you're reading and from Gayhart or another textbook or another source is fine. Don't say Dr. Plant, cite another source. Now what we're going to do is we're actually going to show how is Olivia showing a disconnection between her authentic self. So Olivia appears to be struggling with the disconnection between her authentic self and the identity she has developed in response to the expectation of others. Throughout her life, she's learned that approval, belonging, and acceptance are linked to being responsible, successful, and agreeable. How do we know that? Right here. So she works as an accountant because it was encouraged from her parents. Olivia maybe doesn't want to be an accountant. Olivia, right here, feels like she has to be an accountant because her parents sacrificed a lot for her. And so here we see that she is living a life of incongruence. And that's what we want to put here. Like I said, guys, if you don't see it clearly spelled out, say hypothesis, say it's, say even though it's not clearly stated in the vignette, this might be why she's experiencing incongruence. Okay. Or another way to put it, another way to do this is if you want to just type out incongruence in a bold, and then underneath that heading, go ahead and plug in the case to that concept. I just want to see I want to see your understanding of the concept and specifically how it applies to the case that you're reading. Okay, another one is, and so here we have shoulds. So here we have, she often compares her life to what it should look like and feels ashamed if she's dissatisfied. So here we have a should. Olivia frequently evaluates herself through internalized messages about what she should feel, want, or value. In clinical literature, shoulds are understood. Now, don't put clinical literature. I just put the this here because I didn't want to give away the assignment. But if you read the textbook, you will find the right source for this. Which is why I didn't cite it, because I wanted you guys to actually do the reading and the work. So in clinical literature, shoulds are understood as internal expectations about how a person believes they must think, feel, or behave in order to gain approval or avoid rejection. Cite your source. Psychological distress often emerges when these expectations conflict with the individual's authentic needs and personal agency. Cite your source. Now we're going to plug in Olivia and explain how is she shoulding on herself. Olivia's internal expectations appear to guide many of her decisions, including her career path and the way she navigates relationships. As a result, she experiences an ongoing tension between what she believes she is supposed to do and what she may generally desire. This tension contributes to feeling of emptiness and dissatisfaction and confusion about her identity. Okay, last one. And like I said, guys, even if you don't see a should, you don't have to use shoulds. There are so many concepts you can pull from. So don't, like I said and mentioned, don't get stuck on this is the right concept to explain this. No, we are just getting used to using this verbiage. Another one here is incongruent. So Olivia describes herself as someone who's easygoing and typically goes with the flow. However, she reports periodic episodes of irritability and emotional outburst. So she's actually not easygoing and goes with the flow. She may have feelings of frustration and I'm grumpy today. And so allowing herself to be true, authentic self will be a goal. And the reason why she's in distress is because she's putting on like a facade. So this could be a facade. This could be a gestalt and a boundary disturbance. This also could be an example of incongruence. So at times she becomes slightly overwhelmed with frustration, but struggles to clearly identify the source of these feelings. From a humanistic perspective, this pattern may reflect a state of incongruence, a concept central to person-centered therapy developed by Carl Rogers. And I want you to cite your source. Where'd you get it from? And then here we kind of go down and explain how is Olivia doing it. Okay, so now we want to do treatment goals and interventions. Do not put increased self-actualization as a goal. I want you to expand it and define it and give details to how it relates to Olivia or to your case. So a goal is to increase Olivia's awareness of her authentic thoughts, feelings, and needs so she can differentiate between her own desires and the expectations she has internalized from others. And then the intervention would be the therapist will use empathic reflection and present moment exploration during sessions to help Olivia notice and articulate her emotional and body experiences as they arise. The therapist would gently highlight moments when Olivia uses should language and invite her to explore what she personally wants or feels. This process will support Olivia in developing greater awareness. Cite. Yeah, I want you to cite where you got this intervention from and cite the goal. So, to increase awareness of true authentic thoughts and feelings and needs is a person-centered goal. Cite it. Cite. So cite where you get the intervention from, cite where you get the goal from. So we can see you're actually pulling in specific goals and interventions from the theory. So all your concepts have to be cited, all your interventions have to be cited, all your treatment goals have to be cited. Okay, so here is just some examples of interventions or treatment goals. Goal number 1, increase awareness of internal, emotional, and experiential process. This is a goal. Cite. And then we plugged it in. Olivia would develop a greater ability to notice and describe her thoughts, emotions, and let's just say bodily sensations. Increase authenticity and openness in relationships. Olivia would practice expressing her thoughts and feelings more directly with others while remaining aware of emotional experience. Cite. Okay, so you could write the goals and interventions this way. You could write the goals and this way. You can do 3 goals, 3 interventions. I'm not so worried about the format as I am just you understanding how to conceptualize this case through this lens. Cite. Here's another example. So I'm giving us a bunch of examples to pull from. Another therapeutic intervention is provide a therapeutic environment categorized by empathy, acceptance, and genuineness. Cite. And then give me an example of what you will do. The therapist will consistently communicate warmth and authenticity to create a safe space where Olivia can explore her experiences without fear or judgment. The therapist remains a warm tone, attentive body language to reflect Olivia's experience. Here's an example. It sounds like you spent a long day. I'm sorry, it sounds like you spent a long time trying to meet everybody's expectations. This is a space where all your feelings are welcome, even the ones that feel unconfusing or uncomfortable. I want you to write interventions like so you have a tangible tool, something that you can tangibly leave this class with and apply it to your therapy session when you're treating actual clients. Another possible intervention, and also this is good for your role play. Take some of these ideas for when you're doing your role play too, so you can show and try these interventions. Another one is the encourage. Another intervention is encourage exploration of present moment experience. Sight. During sessions, the therapist will draw attention to Olivia's current emotional and body experiences, helping her notice what's happening internally as she speaks about difficult topics. Here's an example. As you're talking about your parents' expectations right now, I noticed your voice got quieter. What are you noticing happening inside you right now? So we may not have seen Olivia's voice get quieter. We're just having a hypothesis, a pretend example. But this would be an intervention you use if you're seeing a client talk and there's a mismatch in their affect or presentation. That's what you will just point out. As you're talking about this experience, I notice a shift in here. What's happening inside you? That is asking a here and the now question. That is increasing awareness. Or when you describe feeling overwhelmed, what do you notice happening in your body right now? This is an example of intervention. Okay, another one. Let's go down here. This is going to be in the Drive. Sorry, not Drive. Sorry, in Moodle for you to reference. Another one is Gestalt talks about an empty chair technique. An empty chair technique is an intervention where you're basically, it's not an actual chair. You're putting a pretend person, their younger self, even God in the room, and they are going to verbalize what they wanted to say to that individual. So, during the session, the therapist places an empty chair in front of Olivia and invites her to imagine that the chair represents their internal voice that tells her what she should do. You could also say, imagine your mom was here right now. What would you tell her? Let's say your younger self was here. What would you tell her? Let's say your roommate was in this room. What would you want to say? That's a way for them to truly tap into their honest feelings and emotions and express them. So the therapist might say, Olivia, I like you to imagine that voice that tells you what you should do about your career, your relationships, and how you should behave is sitting in the chair. What might that voice say to you? Okay, this is what Olivia may respond with statements such as, you should have been grateful for what you have. You shouldn't complain. You should stay in the career. The therapist then invites Olivia to respond from her own experience. Now, I'd like you to respond to that voice. What do you want it to understand about how you actually feel? And so then Olivia might be expressing feelings that are usually suppressed. I feel pressure to make everybody happy. Sometimes I don't even know what I want because I'm always trying to meet expectations. Then the therapist invites Olivia to switch chairs and speak from the other perspective of the should voice. This is helping her to have an internal dialogue between expectation and authentic desire to deepen the awareness. So during this process of the Gestalt empty chair technique, Olivia becomes more aware of how these internal expectations influence her decisions and emotional experiences. This intervention helps to externalize a conflict, allowing Olivia to recognize the tension between the parts of herself that seek approval and that part that longs for greater authenticity and personal agency. Okay. So go ahead and take a look at this example for how to conceptualize this case to the person-centered language. As I said again, if you are reading the material and there's a concept that I didn't cover in this example, that's totally fine. This is just to help strengthen the muscle and give you language of how to conceptualize a case clinically. The biggest takeaway is expand, give details, and cite your sources. If you have any questions, just let me know. Feel free to send me your paper before it's due if you're confused or stuck. I am really here to support you guys, to make, not to trick you, but to really give you the tools that you need to be the best therapist that God's created you to be. All right. If you have any questions, reach out.